Hello everyone. In this class, we'll study GI hormones. Learning objectives will be to classify GI hormones, name the source and functions of GI hormones, appreciate the role of GI hormones in regulation of GI functions, understand the dysfunctions produced by alteration in the secretion of GI hormones. The hormones secreted from the endocrine cells of the GI tract are collectively known as gastrointestinal hormones. Endocrine cells that secrete GI hormones are called as enteroendocrine cells. Cells that secrete serotonin are called as enterochromaffin cells, and cells that secrete amine and peptides are called as Upwood cells, that is, amine precursor uptake and decarboxylation. Upwood cells are also found in other organs like lungs. They're also called neuroendocrine cells. Carcinoid tumors originate from these neuroendocrine cells. The types of GI hormones, they are divided into gastrin family and secretin family and other polypeptides. Gastrin family that includes cholecystokinin and gastrin, secretin family that includes GIP, glucagon, secretin and VIP. GI hormones of gastrin family, the first one is gastrin. The gastrin is produced by G cell in the stomach that are located mainly in the antral region. G cells are conical cells with apex projecting towards the lumen. Apical surface of G cells contain numerous microvilli. Microvilli of G cells contain receptors for chemicals that mediate gastrin release. Gastrin producing cells also present in hypothalamus, anterior pituitary medulla and fetal pancreas. Gastrin as a neurotransmitter is also secreted from vagus and sciatic nerve. The gastrin is a polypeptide hormone. It exhibits both macroheterogeneity and microheterogeneity. Depending on the number of amino acids they possess, they are named as G34, G17, and G14. The other types of gastrin are C-tetrapeptide, that is carboxyl terminal tetrapeptide, which is also called as mini gastrin, and containing 45 amino acids, that is, it is called as megagastrin. However, G17 is a principal gastrin secreted from the stomach and is a major stimulator of gastric acid secretion. Though the C tetrapeptide executes all the functions of G17, it has only 10% of the physiological strength. Gastrin is released from G cells and enters general circulation. In the blood, the, the half-life of gastrin is less. Half-life of G14 and G17 is 2 to 5 minutes and G34 is about 15 minutes. The gastrin is inactivated in the intestine and it is degraded in the kidney. Functions of gastrin. It causes stimulation of the gastric acid and peptic secretion. It stimulates the growth of the gastric mucosa and mucosa of the intestine. So this is called as a tropic action of the gastrin. It stimulates gastric motility. It causes contraction of the muscles at the gastroesophageal junction. It stimulates the exocrine pancreatic secretion. It also stimulates insulin secretion. It stimulates the mass movement of the large intestine. And it causes colonic contraction that initiates the gastrocolic reflex after meal. So therefore, usually defecation is activated after meal. The gastrin acting on gastrin or CCKP receptors on parietal cells increases intracellular calcium concentration via second messenger IP3. Increased cytosolic calcium activates protein kinase that stimulates potassium hydrogen potassium ATPase to promote acid secretion. How gastrin secretion is controlled? It is controlled by stimuli that increase gastrin secretion. It is gastrin distension, products of the protein distension in the stomach, increase vagal discharge via GRP, that is non-cholinergic, epinephrine, and calcium. Hypergastrinemia occurs in Zollinger-Ellison syndrome. Gastrin secretion is also elevated in pernicious anemia, in which the acid secretion in the stomach is less and parietal cells are damaged. Thus, it causes feedback release of gastrin from G cells. Stimuli that decrease the gastrin release: acid in the stomach, somatostatin, secretin, GIP, VIP, calcitonin, and glucagon. Acid in the antrum inhibits gastric secretion by negative feedback mechanism, which is partly by direct action of acid on G cells and partly by release of somatostatin. So this is how uh, the gastrin secretion is regulated. Food in the stomach, the products of protein digestion, peptides and amino acids, vagal stimulation, they will lead to the secretion of G cells from stomach, which secretes the gastrin, which eventually act on parietal cells on the stomach, which increase the HCl secretion. So HCl increases the acidic duodenal chyme, so that helps in the that induces the production of intestinal hormones like GIP, VIP, somatostatin, and glucagon, which by negative feedback mechanism they inhibits the parietal cells of the stomach and the G cells of the stomach and inhibits the acid production. Whereas HCl secretion, which causes the high acidic contents, they can directly stimulate the G cells to reduce the HCl secretion. Cholecystokinin. It is secreted from the eye cells of the mucosa of upper small intestine. CCK is present as a neurotransmitter in cerebral cortex, in somatic nerves and nerves of the distal ileum and colon. Cholecystokinin is a polypeptide hormone. There are different forms of CCK depending on the number of amino acids present, like CCK 58, 39, 33, 12, 8, and CCK 4. CCK is secreted from the duodenum and jejunum, and usually CCK 12 and CCK 8. CCK in the enteric and pancreatic nerves are mainly CCK 4. So the forms of CCK in brain are primarily CCK 58 and 8. The half-life of CCK is about 5 minutes. Functions. CCK causes contraction of the gallbladder and increases the bile release. It stimulates the pancreatic secretion rich enzymes. Therefore, CCK is also called as cholecystokinin pancreaticozymin, that is CCK-PZ. It also augments the action of secretin to produce alkaline pancreatic secretion. It inhibits gastric acid secretion. It inhibits gastric motility, thereby delays gastric emptying. It causes relaxation of the sphincter of Oddi that allows both bile and pancreatic juice to enter duodenum. It stimulates the growth of pancreas. It increases the secretion of enterokinase. It enhances the motility of small intestine. It stimulates the colonic movements. So this action mediates gastrocolic reflex. It augments the contraction of the pyloric sphincter, therefore prevents the reflux of duodenal contents into the stomach. It also stimulates glucagon secretion. In the brain, it acts as a anorexigenic neurotransmitter. It inhibits the food intake. It also produces analgesia and anxiety. Mechanism action: it has two receptors, CCKA and CCKB. CCKA receptors are mainly located in the peripheral structures like gallbladder, pancreas, GI tract, whereas CCKB receptors are present in the central structures like brain areas. CCK acting on both receptors activate membrane phospholipase C and stimulates the production of intracellular IP3 and DAG. Regulation of secretion. The factors that increase CCK secretion are the contact of intestinal mucosa with the products of digestion, especially fatty acids, peptides, and amino acids. Bile and pancreatic juice. The bile and pancreatic juice facilitate digestion of the protein and fat. Therefore, they provide positive feedback for the CCK secretion. So this is how cholecystokinin secretion is regulated. contact of intestinal mucosa with fatty acids and peptides stimulates the eye cells, which causes the secretion of CCK, increased release of bile, pancreatic secretion, digestion of the protein and fats. The fatty acids and peptides, in turn, they will lead to positive feedback mechanism for the production of the eye cells, uh, and it further releases CCK, and again it is going to increase the amount of proteins and fat in the blood. GA hormones of secretin family. Coming to secretin uh, are secreted from the S cells located in the mucosa of the upper part of the small intestine. It's a polypeptide hormone containing 27 amino acids. Uh, the functions are secretin increases the secretion of pancreatic juice rich in bicarbonate. What it is watery and alkaline pancreatic secretion. It also increases alkaline bile secretion. It augments the action of CCK to produce pancreatic secretion rich in enzymes. It decreases the gastric acid secretion and motility. It causes the contraction of the pyloric sphincter. Secretin acts on adenyl cyclase on the cell membrane and increases cytosolic formation of cyclic AMP. So its secretion is regulated by the in and it is increased by the acidic chyme and products of protein digestion entering the upper part of the intestine. Secretin stimulates watery and alkaline pancreatic secretion. When watery and alkaline pancreatic juice enters intestine, the acidic content of upper small intestine is neutralized. The increased pH of duodenal and upper jejunal content decreases secretin secretion by feedback mechanism. So this is how secretion is regulated. The contact of intestinal mucosa with acid chyme and peptide increases the secretion of secretin from S cells, which is going to stimulate the pancreatic secretion rich in water and bicarbonate. So which is going to neutralize the acid in the duodenum, which leads to decreased duodenal pH. So that negatively inhibits the production of the secretin from S cells. Gastrointestinal peptide. So glucose dependent in this is a also called as glucose dependent insulotropic polypeptide, is a polypeptide hormone containing 42 amino acids. So this is also called as a gastric inhibitory peptide. So GIP is mostly produced by the K cells present in the mucosa of the duodenum and jejunum. So it inhibits the gastric juice secretion and motility. It stimulates the insulin secretion. For this function, GIP is considered as an important physiological regulator of insulin secretion. Though other hormones like gastrin, CCK, secretin, and glucagon also stimulate insulin secretion, the plasma insulin level of insulin in response to GIP resembles the concentration of insulin attained following oral glucose ingestion. Therefore, GIP is called as glucose-like insulinotropic polypeptide. However, GLP-1 derived from glucagon appears to be more potent than GIP in promoting insulin secretion. Hence, both GIP and GLP-1 are among the important physiological regulator of insulin secretion from beta cells of pancreas. So its secretion is regulated by increased glucose and fat in the duodenum. Coming to uh, vasoactive intestinal peptide, that is, it is containing 28 amino acids and it is formed from pre-pro VIP that contains both VIP and PHM27, a closely related peptide. VIP is secreted from the mucosal cells of entire GIT starting from stomach to colon. It is found in the nerves of GIT, the other autonomic nerves, blood, and also brain. The half life is around 2 minutes. VIP markedly increases the intestinal secretion rich in electrolytes and water. Therefore, in excess, it produces watery diarrhea. It also causes vasodilation, therefore, it decreases the blood pressure. It decreases the GI motility. It causes relaxation of the intestinal smooth muscle, including sphincters. It potentiates the action of acetylcholine on salivary glands. It inhibits gastric acid secretion. So clinical significance is the tumor of VIP secreting cells is called as vipoma. The profuse watery diarrhea and hypotension are the major features of vipoma. Glucagon is structurally similar with the glucagon secreted from A cells, alpha cells of pancreas. In GIT, it is secreted from A cells in the stomach and L cells in the intestine, where it is known as enteroglucagon. So this produces hyperglycemia. Glucagon mainly produced from the A or alpha cells in the pancreas and L cells in the intestine. A cells uh, in A cells, pre-glucagon is processed to form glucagon and major proglucagon fragments, that is MPGF. In L cells, it is processed to form glucagon, glycantin, and glucagon-like peptides, that is GLP. Both A and L cells also produce oxyntomodulin and glycatin related polypeptide, that is GRPP. Glucagon-like polypeptides, that is GLP-1 and GLP-2, both are also produced in brain. GLP-1 is a potent stimulator of insulin secretion and GLP-2 does not have a definite biological activity. However, GLP-2 produced in brain inhibits food intake and it acts as a neurotransmitter in the neurons that project from NTS to dorsomedial nucleus of hypothalamus. Oxyntomodulin and GRPP, uh, both A and L cells also produce oxyntomodulin and glycatin related polypeptide. So, oxyntomodulin inhibits gastric acid secretion. So other hormones like Motilin, so this polypeptide hormone containing 22 amino acids, it is secreted from the enterochromaffin cells and MO cells present in the mucosa of all parts of GIT except esophagus and rectum. It acts on G protein coupled receptors on enteric neurons. It causes contraction of intestinal smooth muscle and therefore increases the GI motility, especially in the interdigestive period. So it is a major regulator of migrating motor complex, that is MMC, that regulates the GI motility between the meals. Secretion of motilin is decreased following ingestion of a meal and its concentration remain low until digestion and absorption of that meal is complete. Then the concentration increases and activates MMC that sweeps and cleans the intestine. So thus it prepares the intestine for the next meal. Erythromycin can be used in patients having hypermotility of GI tract as this antibiotic and its derivatives bind to motilin receptors and facilitates intestinal motility. Other peptides like neurotensin, which is a polypeptide containing 13 amino acids, is produced by neurons of mucosal cells of intestinal epithelium, mainly in the ileum. It inhibits GI motility, but it increases the ileal blood flow. Gastrin releasing polypeptide is a polypeptide containing 27 amino acids. It is secreted from the non cholinergic nerves vagal fibers. It mediates gastrin release via non cholinergic vagal stimulation. The 10 amino acid residues at the carboxyl terminal of GRP is almost similar to that of bombesin in amphibians. Somatostatin is a polypeptide containing 14 or 28 amino acids. Somatostatin is secreted from GIT, hypothalamus, and D cells of pancreas. It inhibits gastric secretion. It also inhibits secretion of VIP, GIP, secretin, and motilin. It is an inhibitory neurotransmitter in many parts of brain, especially in hypothalamus and in pituitary. Guanylin is a polypeptide hormone containing 15 amino acids. It is secreted from the cells of the intestinal mucosa. In humans, it is produced by Penneth cells, that is, endocrine cell located in the crypts of libocule of small intestine. It acts by stimulating the activity of guanylyl cyclase, which increases the concentration of cyclic GMP. The cyclic GMP in turn increases the activity of chloride channels and increases the chloride secretion from the intestine. Guanylyl increases the secretion of chloride ions into the intestinal lumen and therefore regulates the fluid movement across the intestinal tract. Guanylin receptors also present in kidney, liver, and female reproductive tract. In these organs, guanylin appears to control the fluid movement and particularly integrates the action of intestine and kidneys. So enterotoxin or some of the strains of E. coli so that cause diarrhea have a structural similarity with the guanylin. So they are going to activate the guanylin receptors in the intestine and produce fluid secretion into the intestinal lumen. Thyroid regulating hormone structurally similar to the hypothalamic TRH, but it does not enter circulation. It do not produce any effect on thyroid. However, it is involved in the regulation of secretory immunity of the intestine. ACTH is structurally similar to that of ACTH of anterior pituitary. The function of intestinal ACTH is not clearly known. Ghrelin is a 28 amino acid polypeptide secreted mainly from the stomach, and it has more synthetic effects on the local. Uh, it has more systemic effects than the local actions. It is a strong orexigenic agent that increases the food intake by acting on arcuate nucleus of the hypothalamus. It stimulates secretion of growth hormone from anterior pituitary. Peptide YY is a hormone secreted from small intestine and colon. It inhibits gastric secretion and motility, hence, it is proposed to be an effective gastric inhibitory peptide. Its secretion is stimulated by the presence of fat in jejunum, though structurally it resembles neuropeptide Y that stimulates food intake. Peptide YY inhibits feeding. Substance P is secreted from endocrine cells and neurons of entire GIT starting from stomach to colon. It increases the intestinal motility. So this is all in brief about the gastrointestinal hormones. Thank you.